Prometric QA and Rationale 61-120. Part 3. 101. Which observation would the nurse expect to make after an amniotomy? A. Dark yellow amniotic fluid. B. Clear amniotic fluid. C. Greenish amniotic fluid. D. Red amniotic fluid. 101. Answer B. An amniotomy is an artificial rupture of membranes, and normal amniotic fluid is straw-colored and odorless. A, C, and D are abnormal findings. 102. The client taking Glyburide, Diabeta, should be cautioned to A. Avoid eating sweets. B. Report changes in urinary pattern. C. Allow 3 hours for onset. D. Check the glucose daily. 102. Answer D. Diabeta is an antidiabetic medication that can result in hypoglycemia. A, B, and D are incorrect because they are not related to diabeta. 103. The obstetric client's fetal heart rate is 80 to 90 during the contractions. The first action the nurse should take is A. Reposition the monitor. B. Turn the client to her left side. C. Ask the client to ambulate. D. Prepare the client for delivery. 103. Answer B. The normal fetal heart rate is 120, 160 bpm, 100, 110 bpm is bradycardia. The first action would be to turn the client to the left side and apply oxygen. Answer A is not indicated at this time. Answer C is not the best action for clients experiencing bradycardia. There is no data to indicate the need to move the client to the delivery room at this time. 104. Arterial ulcers are best described as ulcers that A. Are smooth in texture. B. Have irregular borders. C. Are cool to touch. D. Are painful to touch. 104. Answer D. Arterial ulcers are painful. A, B, and C are incorrect because they do not describe arterial ulcers. 105. A vaginal exam reveals a footling breech presentation. The nurse should take which of the following actions at this time? A. Anticipate the need for a cesarean section. B. Apply an internal fetal monitor. C. Place the client in genupectoral position. D. Perform an ultrasound. 105. Answer B. Applying a fetal heart monitor is the correct action at this time. There is no need to prepare for a cesarean section or to place the client in genupectoral position, knee chest, so answers A and C are incorrect. Answer D is incorrect because there is no need for an ultrasound based on the finding. 106. A vaginal exam reveals that the cervix is 4 cm dilated with intact membranes and a fetal heart tone rate of 160, 170 bpm. The nurse decides to apply an external fetal monitor. The rationale for this implementation is A. The cervix is closed. B. The membranes are still intact. C. The fetal heart tones are within normal limits. D. The contractions are intense enough for insertion of an internal monitor. 106. Answer B. The nurse decides to apply an external monitor because the membranes are intact. Answers A, C, and D are incorrect. The cervix is dilated enough to use an internal monitor if necessary. An internal monitor can be applied if the client is at 0 station. Contraction intensity has no bearing on the application of the fetal monitor. 107. The following are all nursing diagnoses appropriate for a gravida 1 para 0 in labor. Which one would be most appropriate for the primagravida as she completes the early phase of labor? A. Impaired gas exchange related to hyperventilation. B. Alteration in placental perfusion related to maternal position. C. Impaired physical mobility related to fetal monitoring equipment. D. Potential fluid volume deficit related to decreased fluid intake. 107. Answer D. Clients admitted in labor are told not to eat during labor to avoid nausea and vomiting. Ice chips may be allowed, but this amount of fluid might not be sufficient to prevent fluid volume deficit. In answer A, impaired gas exchange related to hyperventilation would be indicated during the transition phase. Answers B and C are not correct in relation to the stem. 108. As the client reaches 6 cm dilation, the nurse notes late decelerations on the fetal monitor. What is the most likely explanation of this pattern? A. The baby is sleeping. B. The umbilical cord is compressed. C. There is head compression. D. There is uteroplacental insufficiency. 108. Answer D. This information indicates a late deceleration. This type of deceleration is caused by uteroplacental lack of oxygen. Answer A has no relation to the readings, so it's incorrect. Answer B results in a variable deceleration, and answer C is indicative of an early deceleration. 109. The nurse notes variable decelerations on the fetal monitor strip. The most appropriate initial action would be to A. Notify her doctor. B. Start in 4. C. Reposition the client. D. Readjust the monitor. 109. Answer C. The initial action by the nurse observing a late deceleration should be to turn the client to the side, preferably the left side. Administering oxygen is also indicated. Answer A might be necessary, but not before turning the client to her side. Answer B is not necessary at this time. Answer D is incorrect, because there is no data to indicate that the monitor has been applied incorrectly. 110. Which of the following is a characteristic of an ominous periodic change in the fetal heart rate? A fetal heart rate of 120-130 bpm. B. A baseline variability of 6-10 bpm. C. Decelerations in FHR with fetal movement. D. A recurrent rate of 90-100 bpm at the end of the contractions. 110. Answer D. A deceleration to 90-100 bpm at the end of contractions are late decelerations. This finding is ominous, bad, and should be reported. A, B, and D are normal findings and are therefore incorrect. 111. The rationale for inserting a French catheter every hour for the client with epidural anesthesia is A. The bladder fills more rapidly because of the medication used for the epidural. B. Her level of consciousness is such that she is in a trance-like state. C. The sensation of the bladder filling is diminished or lost. D. She is embarrassed to ask for the bedpan that frequently. 111. Answer C. Epidural anesthesia decreases the urge to void and sensation of a full bladder. A full bladder will decrease the progression of labor. Answers A, B, and D are incorrect for the stem. 112. A client in the family planning clinic asks the nurse about the most likely time for her to conceive. The nurse explains that conception is most likely to occur when A. Estrogen levels are low. B. Luteinizing hormone is high. C. The endometrial lining is thin. D. The progesterone level is low. 112. Answer B. Luteinizing hormone released by the pituitary is responsible for ovulation. At about day 14, the continued increase in estrogen stimulates the release of luteinizing hormone from the anterior pituitary. The LH surge is responsible for ovulation, or the release of the dominant follicle in preparation for conception, which occurs within the next 10 to 12 hours after the LH levels peak. Answers A to C and D are incorrect because estrogen levels are high at the beginning of ovulation, the endometrial lining is thick, not thin, and the progesterone levels are high, not low. 113. A client tells the nurse that she plans to use the rhythm method of birth control. The nurse is aware that the success of the rhythm method depends on the A. Gauge of the client. B. Frequency of intercourse. C. Regularity of the menses. D. Range of the client's temperature. 113. Answer C. The success of the rhythm method of birth control is dependent on the client's menses being regular. It is not dependent on the age of the client, frequency of intercourse, or range of the client's temperature. Therefore, answers A, B, and D are incorrect. 114. A client with diabetes asks the nurse for advice regarding methods of birth control. Which method of birth control is most suitable for the client with diabetes? A. Intrauterine device. B. Oral contraceptives. C. Diaphragm. D. Contraceptive sponge. 114. Answer C. The best method of birth control for the client with diabetes is the diaphragm. A permanent intrauterine device can cause a continuing inflammatory response in diabetics that should be avoided. Oral contraceptives tend to elevate blood glucose levels, and contraceptive sponges are not good at preventing pregnancy. Therefore, answers A, B, and D are incorrect. 115. The doctor suspects that the client has an ectopic pregnancy. Which symptom is consistent with a diagnosis of a ruptured ectopic pregnancy? A. Painless vaginal bleeding. B. Abdominal cramping. C. Throbbing pain in the upper quadrant. D. Sudden, stabbing pain in the lower quadrant. 115. Answer D. The signs of an ectopic pregnancy are vague until the fallopian tube ruptures. The client will complain of sudden, stabbing pain in the lower quadrant that radiates down the leg or up into the chest. Painless vaginal bleeding is a sign of placenta previa, abdominal cramping is a sign of labor, and throbbing pain in the upper quadrant is not a sign of an ectopic pregnancy, making answers A, B, and C incorrect. 116. The nurse is teaching a pregnant client about nutritional needs during pregnancy. Which menu selection will best meet the nutritional needs of the pregnant client? A. Hamburger patty, green beans, French fries, and iced tea. B. A roast beef sandwich, potato chips, baked beans, and cola. C. Baked chicken, fruit cup, potato salad, coleslaw, yogurt, and iced tea. D. Fish sandwich, gelatin with fruit, and coffee. 116. Answer C. All of the choices are tasty, but the pregnant client needs a diet that is balanced and has increased amounts of calcium. Answer A is lacking in fruits and milk. Answer B contains the potato chips, which contain a large amount of sodium. Answer C contains meat, fruit, potato salad, and yogurt, which has about 360 milligrams of calcium. Answer D is not the best diet because it lacks vegetables and milk products. 117. The client with hyperemesis gravidarum is at risk for developing A. Respiratory alkalosis without dehydration. B. Metabolic acidosis with dehydration. C. Respiratory acidosis without dehydration. D. Metabolic alkalosis with dehydration. 117. Answer B. The client with hyperemesis has persistent nausea and vomiting. With vomiting comes dehydration. When the client is dehydrated, she will have metabolic acidosis. Answers A and C are incorrect because they are respiratory dehydration. Answer D is incorrect because the client will not be in alkalosis with persistent vomiting. 118. A client tells the doctor that she is about 20 weeks pregnant. The most definitive sign of pregnancy is A. Elevated human chorionic gonadotropin. B. The presence of fetal heart tones. C. Uterine enlargement. D. Breast enlargement and tenderness. 118. Answer B. The most definitive diagnosis of pregnancy is the presence of fetal heart tones. The signs and answers A, C, and D are subjective and might be related to other medical conditions. Answers A and C may be related to a hydatidiform mole, and answer D is often present before menses or with the use of oral contraceptives. 119. The nurse is caring for a neonate whose mother is diabetic. The nurse will expect the neonate to be A. Hypoglycemic, small for gestational age. B. Hyperglycemic, large for gestational age. C. Hypoglycemic, large for gestational age. D. Hyperglycemic, small for gestational age. 119, answer C. The infant of a diabetic mother is usually large for gestational age. After birth, glucose levels fall rapidly due to the absence of glucose from the mother. Answer A is incorrect, because the infant will not be small for gestational age. Answer B is incorrect, because the infant will not be hyperglycemic. Answer D is incorrect, because the infant will be large, not small, and will be hypoglycemic, not hyperglycemic. 120. Which of the following instructions should be included in the nurse's teaching regarding oral contraceptives? A. Weight gain should be reported to the physician. B. An alternate method of birth control is needed when taking antibiotics. C. If the client misses one or more pills, 2 pills should be taken per day for 1 week. D. Changes in the menstrual flow should be reported to the physician. 120. Answer B. When the client is taking oral contraceptives and begins antibiotics, another method of birth control should be used. Antibiotics decrease the effectiveness of oral contraceptives. Approximately 5 to 10 pounds of weight gain is not unusual, so answer A is incorrect. If the client misses a birth control pill, she should be instructed to take the pill as soon as she remembers the pill. Answer C is incorrect. If she misses 2, she should take 2. If she misses more than 2, she should take the missed pills, but use another method of birth control for the remainder of the cycle. Answer D is incorrect, because changes in menstrual flow are expected in clients using oral contraceptives. Often these clients have lighter menses.